Hi everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. In this episode we're going to be talking about how to reduce pain at follow-up mammograms after breast cancer. So I just want to start this video off by saying that the information in this video is specific to women who have had breast cancer and are returning for a follow-up mammogram. So just keep that in mind if you're watching this video and you haven't had breast cancer or you haven't had a mammogram before. Breast pain at follow-up mammograms is a really common issue that crops up as a question in my clinic on a pretty regular basis, and it's quite understandable because of the physical aftermath that breast cancer treatment can cause. There's also a lot of anxiety and stress that can occur at follow-up mammograms because of fear of breast cancer recurrence. So if there's any way we can make this procedure less stressful by reducing physical pain, then I think it's a very worthwhile cause to do so. I should just put a little note in here as well to say that if fear of recurrence is really starting to dominate your life or impact your quality of life, then it might be time to consider a referral to a psychologist or a counsellor and see if you can't reduce the frequency and the intensity of that fear of recurrence, because it'll definitely help you at repeat mammogram time. If you haven't checked it out already, a few weeks back I did a really good video with my breast cancer counsellor Julie Bolton where we talked about the practice of mindfulness. So I'll just leave a link to that video above now, and if you haven't checked out how mindfulness can make an impact on reducing anxiety, particularly fear of recurrence, go and have a look at that video because that's a really good one to watch. So let's talk about why follow-up mammograms after breast cancer can be more painful than a standard mammogram. The reason behind this is fourfold, I believe. The first reason is because of scars. There's a lot of scars that can occur following breast cancer treatment. This might include a low-sitting axillary lymph node dissection scar, so a scar that might be sitting a little bit low in the armpit. It might be a lumpectomy scar, it could be a breast reconstructive scar, or it could be a breast reduction scar. So there's quite a lot of scars that can occur, and if scar tissue is tight or sensitive, it's going to be painful if mechanically pressed, and that's certainly what happens at a mammogram. There's a lot of mechanical pressure applied to the breast, and this is why scar tissue can make a follow-up mammogram more painful than normal. The second issue that can affect women after breast cancer treatment at follow-up mammogram is radiation fibrosis. So radiation fibrosis is the latent effect of radiation therapy, and ultimately what that means is that the tissue that's been radiated can become thickened and scarred. It can be quite painful to touch, and it might cause a few new lumps and bumps, which can unnerve people understandably. But again, because of the change in the tissue, you apply mechanical pressure to that tissue at a follow-up mammogram. This can be the source of a lot of pain at mammogram time. So if you want to go and check out any of the video links that I've done on radiation fibrosis scarring, please do so, but I'll leave a link to one of them here. I would say that radiation fibrosis of breast tissue is probably the second most common problem that I treat in my clinic every week, apart from lymphedema. Breast cancer patients typically have to undergo repeat mammograms every 12 months. So it's a really good thing to focus on improving the mechanical pressure that can be applied to your breast tissue, because otherwise every 12 months it's going to be an uncomfortable process. It's already a stressful process because of the nature of what they are doing, but at the end of the day, if we can reduce some of the stress and anxiety around a follow-up mammogram by improving the ability of the breast tissue to cope with that procedure, then I think that's a very good idea. The third most common reason that people will experience pain at follow-up mammograms is breast swelling. So again, breast swelling can come off the back of surgery, but particularly radiation. So if you have an enlarged breast because there's excess fluid in it and mechanical pressure gets applied, fluid that's sitting in a space where it just normally wouldn't be when it's getting squeezed is probably going to be uncomfortable. So I have done a previous video on manual lymphatic drainage after breast cancer, and if you need to go and check out that video, I'll leave a link to it here. and that is going to walk you through how to perform manual lymphatic drainage of your breast. It's a very worthwhile thing to do if you've got an enlarged swollen breast after breast cancer treatment, because again, at follow-up mammogram, if you have a swollen breast combined with a radiated breast and radiation fibrosis scarring at that, and you've got surgical scars on top of all of those things, then that could be quite an uncomfortable mammogram to have to experience. The fourth reason I'd like to mention that pain can be increased at follow-up mammograms is anxiety. Now, this might seem like quite a straightforward thing to talk about, but the reason I bring this up is because if your anxiety levels are higher, even if it's not to do with your scars, but more to do with, say, fear of breast cancer recurrence, anxiety at high levels is going to make you more sensitive to pain. So higher levels of adrenaline and cortisol, which get released when you're under a lot of stress, are going to increase your sensitivity to pain. So think about some of these strategies that you might be able to engage with to reduce your level of anxiety leading into a follow-up mammogram. As I mentioned before, mindfulness might be a simple technique that you can go and study in the lead up to your mammogram. But the other thing, as I mentioned before, is getting a referral to a psychologist or a counsellor, ideally one that specialises in looking after people who have had breast cancer, to really see if you can't bring down some of that stress around repeat mammogram time. So in the weeks and months leading up to your repeat mammogram, I would recommend that you get familiar with your breast tissue. Even though women and men who have had breast cancer are supposed to be checking for new lumps in breast tissue, which is obviously a very important job to be doing, the other reason I want people to get familiar with their breast tissue is for reduction of pain at follow-up mammograms. So if you're feeling your breast tissue and you're noticing hard, firm scars, sensitive scars, excess swelling hanging around the breast, then that's every reason to get started with manual lymphatic drainage to reduce the swelling, and then also scar tissue massage. What I would recommend is that for 5 minutes once a day in the shower, where you've already got your clothing off, you can start doing some tolerable massage on the breast tissue. Ideally, you want to be directing the massage in towards the center of your body and or up towards your collarbone. You want to make sure the massage is done in a firm pressure, because recent research has found that firm pressure is more effective than light. So firm pressure that you can tolerate for 5 minutes in an inward direction or an upward direction, ideally with a moisturizer or even a body wash. It's not really what's in the cream that's creating the improvement in the tissue flexibility, it's really what you're doing with your own hands. So it doesn't matter, or certainly I don't worry too much about what creams my patients are using, as long as they're using a cream so that they don't rub or pressurize the skin too much. Some therapists don't recommend patients do their massage in the shower for fear that they're going to slip over the skin if there's water already over the top of the skin. I think this would have applied when we used to tell people that light pressure was the way to go. Now that we've changed our pressure to firm, it's much better, I believe, to do your massage in the shower, because you've already got your clothing off, you're hopefully in a warm, safe, comfortable space. It also means that you don't have to fit your massage into your day somewhere by leaving a group of people like your family or your friends to go into a separate room to do your massage. You're already in the shower with your clothing off, you're warm, you're comfortable, and hopefully you can leave your moisturiser in the shower and get it done within 5 minutes. As a complementary treatment option, I have spoken a number of times in different videos about products like Mobiderm. So Mobiderm has foam squares stuck between 2 bits of hypoallergenic tape. And this is a product that you can wear directly against the tissue of your breast. And as you move about through the day, this is going to create a massaging effect as you're moving with the Mobiderm. This can be placed directly against the skin, as I mentioned, underneath a bra or a crop top, and it has a really excellent effect at breaking up tight, firm scars, but it also improves lymphatic flow of the breast. So if you've got a swollen breast or if you've got tight, sensitive scars, these are a really great complement to breast massage as well. So the take-home message of this video, guys, is to get familiar with your breast tissue, get started on improving the flexibility of that tissue and reducing any breast swelling in the weeks and months leading up to your mammogram. Thank you so much for watching this video, guys. I hope you've gained some really great information. If you have any questions about pain or reducing pain at follow-up mammogram, then please leave a comment in the section below. Remember to subscribe to the channel, which is completely free, and give this video a big thumbs up. I hope you're having a great week wherever you are. I'll be back next week with another video. I'm Jen McKenzie, the breast cancer physio, and I'll see you next time.